So like Neil said, I'm Dena. I also go by Dena DNA. I'm on lots of social media platforms, using them to educate about different genetics, different subjects within genetics. But the one that's really the first is chromosome 18, because I have a sister with ring 18. So here is Ellie, and I'm so proud of her. I love incorporating her in a lot of my social media as well. And so let's start. So we're gonna just go over the basics of genetics. And actually what I want to do before I start is I want to, since there's, how many people here? Let's see, there's like 6 people listening, right? If you could say in the chat, if you can put your, what grade you are in, or if you're out of school, if you are past college, what you majored in. Is that possible that, that people can write that in the chat? Okay, 9th grade. So freshman in high school. 7th grade, okay. Awesome, middle school. And the reason I'm asking is because I want to kind of have an idea of where everyone is in their knowledge of biology. So I have Julia and Letisa have said 9th and 7th. So anyone else, if you could put in the chat your grade or your let's see. Oh yeah, if you're from a different country, put your age. That works too. And I'll just give it a second. Okay. So as people are doing that, I'm going to kind of go back to the very beginning. So I know some of you have probably had some biology, and okay, of course they're mowing a lawn right as I'm speaking. So let me know if that sound is bothering anyone. Okay, so so we're just going to kind of start out from the very beginning. So when we think of our biology, we know that every human is made up of cells, and cells are like bricks in a house. So from far away, you can't see them like if you're in an airplane, but close up, you can see each individual brick in a house. And so this is kind of the metaphor I like to use with what we're made up of. And so there are different types of cells in the body. There's lots of different types. There's muscle cells, skin cells, nerve cells, and they all have different jobs. And what tells them what kind of job they have? Well, these things in our cells we call genes. So the way this works is that in every cell we have our chromosomes. And those are instructions that tell the cells what to do. They're packages of this DNA material. And so when we look at a chromosome really closely, we see that it's made of, like I said, this package of very tightly wound up DNA. And here's my animations here. So if we were to unwind a chromosome, we would see that it's this helix that you may have seen pictures of. And in our DNA, it's made up of an alphabet of 4 letters. And those letters are basically what tell our body, it's the basis of everything in our body. And so a segment of DNA is called a gene. And those letters that they're made up of are called base pairs. So if you ever hear those words, or the ATCG, those are the alphabet of our DNA. So the cell reads through the DNA as the instructions on what to do, kind of like a recipe. So the way I like to kind of describe this is that every cell has its own library of this genetic information, and every chromosome in the cells is like a book in the library. And if we think of the books as recipe books, then every gene is a recipe in these books, and our DNA or our base pairs are basically the ingredients. They tell the cell what ingredients to use for these different recipes. And so let's just review. So like I said, inside of every cell, there's chromosomes, which are made of DNA, and a segment of DNA is a gene, and it's made up of these 4 letters. So now let's talk about how we get these chromosomes. So we get we have 46 in total, and they come in pairs. So every chromosome, we have 2 copies in every single cell in our body. We have 23 from mom's egg, and we have 23 from dad's sperm, and those combine and go together to give somebody their genome, basically. So we are always made up of half of our mom and half of our dad's DNA, or chromosomes. And so when we break open a cell and we look at the chromosomes when they're all spread out and we line them up from biggest to smallest, it looks like this. So this is called a karyotype, or what's called a metaphase spread. That's another word for it. And this is just a picture of our chromosomes. And so if you can see, there are differences between what are typical males and typical females. And so usually I like to ask people if they can figure out which one is which, but I'll just tell you. So females have 2 X chromosomes, and males, for the most part, have an X and a Y chromosome. And so that's where you can see the differences on these karyotypes here. And so the left is female, the right is male. And so let's look at the 18th chromosome, because that is our star chromosome pair for today. And so this is what the anatomy of a chromosome looks like. So these 2 parts of this chromosome 18, we call them arms. And the small arm is called the P arm. And you could think of it as P for petite. And then the arm that's a little bit longer is the Q arm. That's the longer arm. And so when we look at chromosome number 18, like I said, short arm is the P arm, and long arm is the Q arm. We have it's made up of about 76 million base pairs. So those letters, that alphabet I was talking about, there's 76 million of them on chromosome 18, which is about equivalent to 263 different genes. So that is a lot of genes. So basically chromosome 18 is a recipe book full of 263 different recipes. So when we look at what we would consider typical, or somebody who's unaffected, we mostly have 2 copies of the chromosome 18 in every cell, which means that we have 2 copies of every single gene that's located on chromosome number 18. So sometimes the cells actually make a mistake when they're copying their instructions, or when they're coming from mom or dad. And then what can happen is that part or all of a chromosome might be missing or added. And so having too many or too few copies of a gene or part of a gene can cause harm, depending on the behavior of that specific gene, or the behavior or what that recipe is needed for. So just some vocabulary: a deletion is when a piece is missing. A duplication is when it is added or extra. And the prefix tri means 3, and tetra is 4. So that's something just to remember. If you could remember these things, then you can kind of figure out what a lot of these syndromes are. So let's go through the different ones. So the first one is when part or all of the P arm is missing. And in this case, we call it 18p minus, or an 18p deletion syndrome. And so in this case, the person only has 1 copy of the gene that's deleted, in the deleted region of the P arm on the 18th chromosome. As you can see here, 1 has been deleted, and that means that whole string of DNA, there's only 1 there. So then we can think of, there are different parts that can be missing with either P or Q, but usually with 18Q minus, it's when we have part of the Q arm deleted. So that can mean either what we call proximal, which is the kind of the middle part. So then that person only has 1 copy of all the genes located in that area of the chromosome, or distal, which is kind of the end of the Q arm. And so then that person will only have 1 copy of those genes. So that's 18Q minus. And then we have ring 18, and this one's a little bit different. So in ring 18, we have both of the sides of the 18th chromosome, both the part of the P and part of the Q are missing. So what happens is that the chromosome ends up sticking together and forming a ring. So ring 18 is kind of a mix between 18q minus and 18p minus. That's what that is. And then we have trisomy. So if you remember, tri means 3. So trisomy 18 is when somebody has an extra copy of the entire 18th chromosome, which means that instead of 2 copies of all those 263 genes, there are 3 copies. And that can be that can cause harm as well when you have too many or too few copies. So then we have chromosome tetrasomy 18p. And okay, sorry. And this is when we have the P arm copies itself. And so then we have 4 copies of every gene on the 18th chromosome. Sorry, hold on 1 second. All right, work from home difficulties here. Okay, so tetrasomy 18p, the person has 4 copies of every gene on the P arm of chromosome 18. So that's what this looks like. And again, tetra means 4. That's why that's called that. And then there's these ones that are a little more rare. So there's partial trisomy 18p, which is when there are 3 copies, as you can see on the P arm. And this is where I usually have people fill in and try and guess how many copies, but I'll tell you for today. So there are 2 copies of the Q arm. So this person would have a normal amount of the genes on the Q arm, but 3 copies of all on the P. And then partial trisomy 18q, they'd have 2 copies of all the genes on the P arm, but 3 of all the genes on the Q arm. And then we have isochromosome 18q, which just means that there's only 1 copy of the P arm and 3 copies of the Q arm. So these are some of the more rare syndromes within the chromosome 18 spectrum. So why can't we fix a chromosome? So I'm going to end here for a second because I know I've been talking and I want to hear from you guys. Okay, good. You can't hear the loud part. I want to hear from you guys why you think, okay, oops. Why, for everybody here, I want to know, why do you think we can't fix these chromosomes? Does anyone have a guess? And you can show yourself and unmute if you'd like. Any guesses here? Okay, well, the answer is because we have these, our DNA or our chromosomes are in every single cell in our body. So we can't go in and fix it because it's not like we only have 1 set of chromosomes. We have them in every place in our body. So let me go back to sharing this. Okay. So we're born with all of our chromosomes, and every cell in our body has its own set of chromosomes. There are about, I think this is a trillion, 37 trillion, 200 billion cells in our whole body. And so you can't really go in and fix each of those. And that means that we have that many sets of chromosomes. So that's why we can't just go in and fix 1. But we can work on fixing the function of these genes. So the way that our cell reads these recipes, there are technologies and there's research going on to try and fix the way that our cell reads through these recipes to try and help it kind of normalize if there's too many or too few of some of these genes. So why is this important information? Well, if we know what genes are missing or added, then we know for that person what symptoms they may show. So sometimes they match with the way that our siblings may behave or some of the medical issues they may have. And so basically, I want to go over the different testing methods because you may hear about this. So when my sister, who is 26 now. When she was born, the only type of testing that was available was a karyotype. And that's this photo of the chromosomes that looks at large pieces missing or added, but it doesn't know which genes are missing or added. It only knows the pieces and the picture of them. So that's what it looks like. Well, today we have something called a microarray, and this is a type of test now that's a newer technology that actually looks at higher resolution. So it zooms in a lot more on these chromosomes, and it actually detects smaller changes that are missing or added. So a lot of the people that end up coming to Chromosome 18 conferences now may not have been detected before by karyotype testing. And so now that we're able to do this microarray testing, we're able to find these people that have smaller deletions or duplications that weren't seen before. And so we can actually tell with microarray which genes are deleted or duplicated. And so this is what it looks like. It's actually zooming in on a really small piece of our chromosomes to see the exact genes affected versus the karyotype, which is just a picture. And so that's all the information I wanted to go through today. So I would love to open this up to any questions that people have. And please follow me if you're on TikTok, if you're on Instagram or Twitter. I do a lot of information. I talk about my sister with ring 18. I talk about chromosome 18. I talk about other genetic conditions. So love to have you as a follower. And yeah, so that's everything I wanted to go over. I'd love to hear from you guys. If you could unmute yourselves, if you could show your screen so I can see you and just hear any questions that you may have.
Dena, so just whilst people are kind of thinking about some questions they might be able to ask, do you mind if I ask you a couple of questions?
Absolutely, would love it.
Is that so? We hear a lot about this thing called CRISPR. How is that going to change kind of like a DNA or DNA research moving forward?
Great question. So CRISPR is a type of technology that's basically like an editor. Like if you were to go in, if you were typing up a paper, you can go in and you can take out a word and add a different word. And so it's a technology that can be used to fix some of these genes that may be faulty and replace them. Now, when we think about doing this type of gene editing, there's two ways to think about it. One is editing just the cells in a certain area of the body. So for instance, if somebody has like issues with blindness and because of a gene defect, they can go in and they can edit some of the cells that are in the eye and then maybe help with that condition, or in their blood, like people with hemophilia who have problems with clotting factors, they can fix little pieces at a time. So that's one type of CRISPR, and that I think has a lot of potential for some of for lots of different conditions. And then there's something called embryo editing, and that would be where you actually edit the embryo or the egg, the fertilized egg, before it develops into a person. And so that would be basically editing all of their future cells and then any of their offspring. So whatever edits you make would then pass on to their children. We call that germline editing, and that's a little more tricky. When it comes to chromosome abnormalities like this, typically CRISPR is used for like single genes or single parts of genes, and hasn't really been used in full chromosome deletions or duplications. But I'm sure there'll be some sort of technology at some point that will probably be able to edit embryos at some point. I don't think we're there now. So I think there's a lot of promise there. But, oh, I see someone says they already used it for some conditions. Exactly, yeah. Like I was talking about hemophilia and blindness, and there's a number of other conditions they've used it for. It doesn't actually alter the whole body's DNA, but it alters the DNA. It's considered a gene therapy by altering the DNA in the area that needs the genes to not function or to function differently. So anyway, I think there's a lot of promise for it in the future for sure. And there's a lot of kind of ethics involving germline editing and editing embryos. But I think, yeah, it's definitely something that we can look forward to in the future.
Great. And I know you've been involved for quite a while with, you know, kind of all things genetics and DNA and what have you. Would you mind sharing a little bit about the story on why, you know, what growing up with your sister, perhaps how you got to this place?
Yeah. So my sister we were really lucky that Ellie was diagnosed really early because my mom's a doctor, and she knew when my sister was born there was something wrong. She was able to get her tested very quickly, and then they found out that she had this ring 18 chromosome abnormality. Hers was mosaic, which means that only some of her cells are affected, but not all of them. And the thing about mosaicism, by the way, if your sibling is mosaic, is that you cannot actually know how mosaic they are, because you can't go in. You would have to go in and biopsy every tissue in their body to see what is affected and what isn't. So you have to still treat it as if they weren't mosaic in terms of some of the conditions you look out for. But anyway, so Ellie was mosaic ring 18. So my parents were able to connect with Janine very early, and they were able to get her started on growth hormone very early. And I saw how that really helped my family. It helped Ellie in her development. And so that made me realize that I wanted to do something with genetics where I could help other families like mine. And it's funny because I didn't originally want to be a genetic counselor. I was thinking a lot of other different things. And then Janine, I remember, was a big supporter of genetic counselors, still is, and introduced me to one. And she and my mom kind of got me more interested in it as a profession. And I went into it and I love it. So it was really Chromosome 18 that got me to be a genetic counselor.
Well, and thank you for kind of sharing that. I know it's a very personal story, but for other siblings that are here, is that that's something that is a great career that, as you say, has a profound effect on a lot of other people.
Absolutely, yeah. And the other thing I was going to say, I want to mention is that I'm friends with a lot of the Chromosome 18 siblings still, and there's just something about being a sibling, not only that attracts you to other siblings, but also makes you a really good healthcare practitioner, because you understand things that cannot be taught, that you can only live. You can only have the lived experience as someone who has a sibling with special needs. And so that's something I think it really makes a really wonderful both genetic counselor or physician or nurse or whatever it is that you want to do. It really sets us apart and gives us these skills that can't be taught.
Great. And I don't want to monopolize. If anybody wants to jump in, please feel free at any stage. Just either type your question in the chat or just jump on and ask the question yourself. But for somebody that's never been to a genetic counselor, and let's say you're going to go along with your the sibling kind of comes along to a doctor's appointment, what would they expect to kind of be talking about, or what would you kind of go through? I suppose I've never been to a genetic counselor, so what kind of exact services do you do, or is it just such a wide range?
Yeah, good question. So as a genetic counselor, I'm trained and board certified in all the areas of genetic counseling, but then what happens is many people go and they specialize. So my specialty happens to be cancer genetics. So I actually mostly see families that have cancer or are at risk for cancer. But originally I wanted to do pediatric genetics because that's the area where you actually help diagnose people with genetic syndromes. So for a lot of the people in the Chromosome 18 community, they were first diagnosed, usually with a genetic counselor or a doctor that then sends them to a pediatric genetic counselor to talk about what life might be like. Some of the, usually they will connect them to Chromosome 18 research and registry. They'll connect them to resources. They'll talk about things that they may be at risk for. They may talk about the growth hormone, if that's something that, I don't know, it depends on the genetic counselor in the clinic, but usually in the pediatric setting, a genetic counselor works with a geneticist, which is a medical doctor, and they work together in a team in helping to diagnose someone and then follow them over time. So that's pediatric genetics. But in cancer genetic counseling and cardiac genetic counseling, those are more just the genetic counselor seeing patients, and that would be assessing for that family history and the person's personal history. And then there's prenatal, which is when, you know, somebody may be pregnant with a fetus that is found to have a chromosome 18 anomaly, and that's where the prenatal counselor can kind of counsel the couple through different options as it pertains to kind of how to continue the pregnancy if they want to, and then what to do once the baby's born. So there's kind of these different areas. So there's not one, you know, I guess thing that we do, but I'd say that most people in the chromosome 18 community would be seeing a pediatric genetic counselor.
Awesome. Well, and thank you for sharing that. For somebody that's never actually been in front of a genetic counselor, is that it sounds kind of like a very imposing title. So is that, and I know that you kind of make it an easy process to kind of for people to understand kind of, you know, what you're doing to help them and how it's going to benefit them.
Yes, thank you. Yeah, I think one of my favorite parts of the pediatric genetic counseling was helping people find a diagnosis, because there are so many people out there that have genetic disorders that don't know they have them. Many times genetics is not the first thing that people get referred to. So when a child is having, you know, the issues where they're having developmental delay, or they're having seizures, or they're having whatever, birth defects, they don't think about genetics. They just think about treating whatever it is that they have first. And so there's a lot of people out there that have chromosome 18 anomalies that don't know it. So a big passion of mine is getting those people in so that they can get the diagnosis and then get connected with this organization or whatever their subsequent chromosome abnormality is in that organization, because you all know how helpful it is to have this community, and people just aren't being diagnosed, unfortunately.
In fact, our conference co-chair, Carrie Lamont, this morning shared that her daughter wasn't diagnosed until she was 16.
Right.
And,
Yeah.
and, you know, it's kind of a shock, I suppose, a shock sometimes. You know, we hear from people that kind of come in, and sometimes it's, you know, it's not generally not that age. It's normally about 7 or 8 that kind of, if it hasn't been diagnosed early. But yeah, it's kind of, as you say, it's super important to do that so they can treat the underlying conditions, right?
Exactly. Yeah. And understand, you know, what is going on and what could be going on. And I once, for my thesis in grad school, I actually attended these disability fairs where it was called the Abilities Expo. And it was all these people with all different disabilities could come and go to these booths. And I had a booth on genetic testing or genetic counseling. And the number of people who came up to my booth and had very clear genetic anomalies but had never been referred to genetics was astonishing. It was like 90% of these people, and there are studies out there like that most people, especially current adults or teens, they've never been tested. They've never had genetic testing, and to me, it's just crazy and really unfortunate, you know, that people aren't offered that right away.
Yeah, no, and I'd say it surprises me kind of like all the time when we hear somebody like Carrie, you know, kind of who kind of said it was 16. So
yeah.
So this is a very random question, but who's your little friend in the background?
Oh, the dog?
Yeah.
Okay, so his name's Poppy, and he is really cute, except we're pet sitting for another dog, and that other dog must have heard something.
Oh.
And he's actually never barked during one of my talks, ever. And of course he barks today because the other dog was barking. And so I just have to know, and you know, if I'm pet sitting, I need to put the other dog farther away.
Hey, you know, we love show and tell, and I know everybody at the staff, apart from me, actually has their dogs, and kind of the dogs are part of the meeting. So is that
okay? Good. Well, he's been scratching on the door. So, Bobby, you want to come in? Okay. Yeah, he wants to come in.
He wants to come in.
Okay. He come say hi. Okay.
Oh wow! What type of breed is he or she?
He's a Chihuahua Poodle Dachshund Pomeranian mix. Wow. Of course, I did genetic testing. That's how I know. He's a rescue.
So did you organize that genetics to kind of put that together?
Oh, no, I wish. But I was really lucky when I found him.
Oh, no, he's very cute. And Poppy?
Thank you. Yeah, Poppy Chulo, yeah.
Poppy Chulo. Well, beautiful. Well,
Thank you.
if anybody has any other questions, please feel free to either open up your screen or put them in the chat.
Okay, so do you want to read the question, or should I read it?
So Judy says, so I think the older you are, the higher chance of having a child with a chromosome 18 disorder. But if you're younger, like teenage pregnancies, does that affect the chances of your child having a chromosome disorder as well?
That's a really good question. Yeah, so the reason, all women, we're born with our eggs. So the eggs that we have are the eggs that we will always have. And so as we get older, those eggs may acquire mistakes. Okay, sorry. And so that's why there's a few different theories about why that happens. It could be that that as the eggs age, they're more likely to have chromosome abnormalities, or that our body is less likely to be able to detect eggs that are chromosomally abnormal. Because the thought is when you're younger, you can detect them, and then your body kind of rids them, and that doesn't end up being a pregnancy. But those are two of the theories. But we do know, just looking at the big population as you get older, that the chance of having chromosome abnormalities does increase with age. As you're younger, I don't think it decreases. I think that it's just not as high, and it just tends to get older. So yes, the younger you are, you're not going to be as high of a risk, but anybody at any age can have a child with a chromosome abnormality, because these things are very random. We don't always know why people have children with chromosome abnormalities. Sometimes it can be that the mom or dad actually carried a really small, what we call translocation, that's balanced. So there could be a piece of a chromosome that's on another chromosome, but they still have the right amount of genes. So the location of the genes doesn't actually matter until you go to pass down your chromosomes, and then you can pass down the wrong amount to the child. And so we call that a balanced translocation and an unbalanced translocation for the child. And that can happen no matter the age, because that's just something that humans have in different families and different people, that just randomly happens. And then in other cases, it's just sporadic during fertilization that it can happen. So I think the short answer to that is the risk is lower when you're younger, but it is not zero. It can still happen. So I hope that answers that question.
Great, thank you. And you mentioned something that I, just for myself, is that you said, so a woman's eggs are kind of like the same, kind of like throughout her whole life.
Mm-hmm.
Is that going to be kind of like despite lifestyle, or kind of, is there things that you can do that will improve it, or is it's just kind of it's set because that's who you are?
Yeah. So so you're born with your eggs, and the eggs can theoretically, like, the quality of the eggs can change, and I'm not a fertility expert, so I don't know exactly what the science behind it is. But I know that, like, there are lifestyle things you can do, like that, like not smoke, right? So smoking can affect lots of different things, and so that can, and there's different, like if somebody has cancer and they have to get radiation to the area, that can also kind of alter the function of the eggs. There's a lot of different kind of situations as women age that they may not realize that can change quality of eggs, but I can't exactly give any evidence-based examples right now, because I don't know them off the top of my head. But yes, and so what's different is with men actually create new sperm every 24 to 48 hours. So it's brand new, but there are things men can do too to lower the chance of having a child with a condition. And also, as men age, there's also a risk as men age that their children can have what's called an autosomal dominant condition, meaning just like a single gene genetic change. So it's not just women, it's also men as they age. Of course, the risk isn't as high with the male age, but yeah, so it's when you think about fertility, if it's something you're worried about or you're thinking about, there are fertility specialists that can talk about, what women or men can do to really increase fertility.
Great.
Yeah.
Well, thank you for sharing that. And I suppose as there's no other question, my last question that is that as a sibling yourself, is that any kind of words of wisdom for other siblings that are kind of listening in, or parents that might be listening in, that things that from the genetic side of things that you've learned or you'd be willing to share?
Yeah. Well, I think something I think is important, and it doesn't really get discussed because there's not really a standard for it. But like I was saying before, some people can have these genetic, these chromosome abnormalities because of carrying these balanced translocations. And even though most people, that's not as common, I think as a sibling, it's possible if your parents carried that, they could pass it to you, and you could also have a balanced translocation. And so any sibling that wants to have children, I think it's actually a good idea to get your chromosomes tested, and it's covered by insurance. I did it for myself because of my sister, just to make sure everything was good, and it was fine. But that's really important information to know when it does come time to have children, because if you're full or even half sibling biologically to somebody with a chromosome abnormality, it's just a good idea to do that. My husband also, he has a brother with a microdeletion, and also got his tested too, and it was covered. So I think that's something we don't really talk a lot about, but I think it's important to have that information along with other genetic testing that can be done. So that's one kind of advice for siblings. And two is that I think it's really helpful to seek out other siblings. Like, this is completely unrelated to genetics, but just no matter what age you are, when I was growing up, I got along very well with other people who also had siblings with disabilities. And so that's something that can be really helpful if you can even volunteer for an organization. I know besides Chromosome 18, where there are other siblings with people with disabilities, you can make some really great lifelong friends that way. So just another kind of piece of advice. Yeah, I'm trying to think if there's any other. I feel like that's what I can think of off the top of my head.
No, that was great. Actually, I don't think I've ever heard anybody express that, as you say, for your first point about kind of getting tested as a sibling, just to be on the safe side, as you go through life and start thinking about a family. So
yeah.
Well, I just wanted to thank you for taking your time out today to be with us. Is that we really appreciate your time and dedication and being part of our Chromosome 18 family for so long. So I think we're kind of getting close to our time. So I don't know if you had any final words you wanted to say.
Oh, well, I was just going to say, these are really great questions, and I would love if anyone has any questions that pop up later, please reach out to me with my email or find me on social media. I would love to have a network of Chromosome 18 siblings and families on social media, because I do post a lot about that. So would love if you could follow me there, and would love to get to know you as well. So yeah, I'm so happy and open to talking to anyone, and especially if you're interested in genetic counseling as a career. It's an amazing career. There's other siblings that are looking into it or are in school for it. So yeah, please reach out to me, and I am so happy to mentor my own community. So I think that's my parting words.
Well, thank you, and we really appreciate it. And that's Dena DNA, right?
Yes, DENA.
DENA.
DNA, yes.
Yeah. Okay.
Yeah.
Just another plug for you there. So
thank you.
Okay.
Perfect.
Well, just a couple of housekeeping items. I know it's been mentioned a lot, but you know, have a look at the merchandise, the silent auctions going on. We're going to be having some syndrome and regional breakouts a little bit later. So we've got a 15-minute break before the next session. And thank you very much indeed. And we enjoyed meeting Poppy as well. So
thanks.
Thanks very much.
All right. Bye, guys. Thank you.
Thank you.